the phrase I heard Shilpa use, and that I kind of heard the thread of in Hillary's comments is this idea of paradigm shift, right? And that is how I set up the question. I was like, we haven't ever invested in social infrastructure. What is happening next? And we are in this moment of paradigm shift. But I guess I don't know if it's play devil's advocate, but think about reframing the question backwards and thinking about the strengths that we have in the past, right? So it's true that we've underinvested compared to peer nations, but at the same time, we do have this long history of investing in social infrastructure through programs like SNAP, which is the former food stamps program, programs like the Child Care Development Block Grant. Like we have to some extent been putting our money where our mouth is. And then states and localities in recent years have really taken bold action on programs like paid leave and pre-K. So I'm wondering, like, how at the same time as we're shifting paradigms, like how should we be building on successes that do exist? So Jessie, as someone who's built the foundation on these issues like paid leave, I'd love to get your thoughts on this.
Thanks, Alex. And maybe I'll start with some deep appreciation for the folks listening into this panel. I imagine many of them have worked on state and local campaigns to expand additional benefits, to look at new infrastructure that could be a model both for their states and for the rest of the country. And so maybe this is how we say paradigm shift. It's also the bending of the arc, right? All of us are pulling that arc down in the way that we need. But I want to lift up a lot of the successes we saw this year, especially in states. Paid sick and safe leave, for example, New Mexico became the 14th state to enact paid sick leave in 2021. And other states looked to expand opportunities if they already had the policy. Paid family medical leave, you had 11 more states considering this proposal this year, and 9 states in DC have already adopted paid family medical leave. Of course, we've heard about the historic investments in unemployment insurance, and yet states took bold action to complement or support or extend benefits as well, and conceived of ways to support different categories of workers that had not been traditionally included. States like Missouri and Washington established their own state-based EITC for the first time, joining 29 other states. And so you can see that there's a lot of work happening at the state level that is connected in this broader framework of change. But I want to be really clear. I think there's some clear lessons about how we build on those successes. First, we should be thinking about the ways that we can leverage interrelated supports. So many states said, how can we complement a federal investment with state-based supports that are targeted because we know our communities best? This interrelated strategy work of advocates, of government officials, of bureaucrats needs to happen where we're saying, how can we think differently about making the impacts that are needed? Second, many of these states that I just mentioned really thought about widening the eligibility framework for many of our social infrastructure policies. And this is to directly contend with what Hillary raised. We have to contend with the history of racism and racist tropes that have been used to undermine our public social infrastructure. And so thinking about including immigrant children, undocumented folks broadly, and removing benefit bans that have been in place, we actually have to do that work. And it is difficult work, but it requires organizing and changing hearts and minds. And then finally, there's technical aspects of program administration. I want to just lift up in Utah and in Tennessee, states that most people don't think about progressive economic reform. They actually looked at technical implications of their child care supports, co-payments, and things like child care subsidies based on attendance rather than daily enrollment, because that actually gets to the heart of how we think about the infrastructure over time. It's those innovations we have to look to and realize technical implementation really does matter when we're building on successes.